Good afternoon and welcome to today's presentation, Improving Resident Satisfaction and Outcomes by Integrating Pharmacy Services in Home Care, Group Home, and Assisted Living Settings. Today's executive web briefing is brought to you by Open Minds and Genoa Healthcare. This afternoon, we are joined by Anthony Zerilli, Franchise Operations Manager at Majestic Residences, Vicki Powell, Director of Business Development for SYNERGY HomeCare, Kelly Anne Deshaies, Director of Nursing at Community Living of Rhode Island, and Stacey Bain, Vice President of Business Development for Assisted Living at Genoa Healthcare. During our time together today, our panelists are going to be covering how their communities have leveraged integrated pharmacy services to navigate census and staffing issues amid the COVID-19 pandemic, and how they have eased staff burden to improve workflow and efficiencies, and also driving higher resident and family member satisfaction. You may notice that all of our attendees have been muted. We're recording today's event, and muting the phone lines assures the highest quality of sound. So that's just why you guys are muted. You won't be able to come on and actually chat and ask questions. And we aren't going to be having a formal question and answer period at the end of today's event, but we are encouraging you to submit your questions on the GoToWebinar question panel at any point throughout the presentation, and our faculty will actually get back to you after today's event on a one-on-one basis to answer any of those questions that you have. And with that, I will pass things over to Stacey.
Thank you, Brittany. I appreciate it. And thanks for the opportunity. So today we're just going to briefly kind of talk about and share some insights from 3 different communities that we work with across the country, and how that partnership has led to increased resident satisfaction and better outcomes through all of the challenges that they have faced since the pandemic started. So we'll just start with some brief introductions. And Anthony, I will let you introduce yourself. Would love for you to share a little bit about yourself, the company that you work for, and maybe even briefly why you are in the business that you're in today.
Good morning, everybody, and good afternoon, wherever you're at, and thank you for being a part of this. My name is Anthony Zerilli. I am the Franchise Operations Director with Majestic Residences. I have owned and operated assisted living homes here in Arizona since the late 90s, so I've got lots of years of experience there. And it all started with caring for our grandparents. So it was a family business, and my mom is a registered nurse, got exposure, and us youngsters grew up doing it until the time we took over the family business, and now we're spreading those cultures and some of that infrastructure throughout the country in our Majestic Residences system. So I look forward to visiting with you folks today and answering any questions you may come across.
Thank you, Anthony. Kelly Anne is joining us today via phone. Kelly, can you share a little bit about yourself, your organization, and why you're in the community that you're in?
Good afternoon. Thank you for having me. My name is Kelly Anne Deshaies. I'm the Director of Nurses for Community Living of Rhode Island. I've been a registered nurse, bachelor's prepared, for over 17 years now. I've been with Community Living of Rhode Island, which is adults with disabilities 21 and over, for over 8 years. I wanted to be a nurse since I was about 3. I always knew I wanted to be a nurse. As a nurse, you have many facets that you can play in. I started off in orthopedic med surg, went on to critical care, went on to trauma 1, and then decided to put my psychiatric degree to good use and became a psychiatric nurse with Community Living of Rhode Island. It's been a wild ride, and every day is different, and I love what I do. I love caring for the participants. I love working with the families that we have, and it's been a wonderful opportunity.
Thank you, Kelly. We appreciate that. And Vicki, can you also give us a brief introduction and share about your community and how you are in the role that you're in today?
Sure, great. Thanks for the opportunity. I'm Vicki Powell. I'm Business Director at SYNERGY HomeCare. We are a non-skilled home health care company, and we allow seniors to stay in their home as long as possible, whether that home is a private residence or a senior living community. I'm actually in this business to honor my father. I was a caregiver for him. He had Alzheimer's for 8 years. And really my mission is to help seniors get the help and services they need. So that's why I do what I do. Thanks for having me.
Thank you, Vicki. And I appreciate you guys sharing some of those personal stories as to how you are in the roles that you are in today and making impacts in each of your communities. Just a little bit about myself. My name is Stacey Bain, and I am a pharmacist and the Vice President of Business Development for our assisted living line of business for Genoa Healthcare. And we appreciate you joining us today. So moving on just a little bit, but before we get started into the meat of our discussion, we would like to open with a brief poll for all of those of you who are joining us today. And the poll is so that we can learn a little bit more about who are joining us. So what type of community do you serve? For those that are joining us today. So it'll be interesting to see where the majority of those who are joining us fall into these categories. And it'll just help us kind of direct our questions and our discussions as we continue to move on throughout the webinar today. So here is the results. So we have split 21% are joining us from either assisted living or memory care communities and or residential group homes. And then obviously we have a significant amount of others joining us as well. So we are hopeful that we can provide some great information to everybody joining today as we continue to move forward. Next slide. So kind of want to talk about and share some of the challenges that we know each of these communities are facing. And I know this is not rocket science by any means. We all know that these are things that every one of you are probably experiencing in your communities, especially since 2019 and the COVID pandemic. But I think the main thing is you know, especially for your communities, are these census challenges. So how do you keep residents and individuals in your communities or in, you know, under your umbrella of care? And how do we, you know, take the challenges that we've seen and be able to continue to serve more people in those same communities as well? So I think the main thing is that there's been a 16% drop in census since 2019 started and the beginning of the pandemic. So that obviously has huge impacts on business and those that we're able to serve. And how can our panelists will be able to tell us today how they have really impacted potentially this drop in census or been able to maintain kind of status quo. So what are some of the other challenges or burdens that we see? One of the main things is obviously staffing shortages, and this is not unique to healthcare. Obviously, right now there is a huge issue or burden across many different business sectors with staffing. But we know, you know, it's tough, right? We have over almost 500,000 open positions as we speak, and we know that's going to continue to grow as we have an aging workforce, as we see, you know, people experience burnout, as well as potentially some of the vaccine mandates that may be coming. So a huge impact on these communities that each of these individuals or panelists can speak to today. And not only are there shortages, I think you can also see that there are some real issues around being able to attract new talent or be able to hire new staff as well. But all of these challenges really comes down to how, through the burdens that we have post-COVID through census or staff burnout, how can we still continue to drive resident satisfaction? Because we know and we can correlate that level of resident satisfaction to overall impact on the business through you know, income and margin that comes in. So We know that great satisfaction scores lead to, being able to have a more healthy, successful business. And our panelists today will be able to share with you a little bit about how each of their communities and each of their different roles have driven to resident satisfaction and been able to maintain and grow their businesses throughout all the challenges that we have experienced. So that's a little bit about, kind of the lay of the land since COVID and all of the challenges that I know all of you joining us today are very familiar with, but really want to start having discussion with our panelists around what they have done that might be unique and how they have managed to come out the other side or kind of in this new norm of COVID and been very successful in each of their individual roles. So our first question for our panelists is, how has your community navigated the COVID-19 pandemic, and what are the key challenges you are facing today? Anthony, can you start us out, please?
Absolutely. The communities that we work with, the franchisees that work throughout the country, we adhere to a home standard. And the home is an acronym for honest, observant, memorable, and empathetic. And so those core values create the culture within our Majestic Residences homes that assures we're meeting or exceeding those standards of care. With COVID, it kind of threw everything for a little bit of a curveball, whether it be staffing or whether it be resident census, whether it be clean home protocols, all of those different dynamics were changed. But because those core foundational values were so solid, we were able to meet and again exceed those standards of care within those small private home settings, assuring there was limited access, points of contact for residents and families and clinicians. We had incorporated lots of different technology to try to keep family and connections together while keeping safety as a #1 priority. We didn't see any large outbreaks or huge numbers within those smaller homes. Our scale is somewhere from 6 to 16 because we were able to implement a lot of those controls to assure that we were keeping, those COVID outbreaks limited. Mandating COVID tests prior to admissions was another key component to assure. And then once vaccines were rolled out, we were able to roll that out to our staff, our residents, and some of our families and volunteers as well. So a lot of those different things helped to assure that we were able to navigate the COVID crisis successfully here.
And Anthony, to that question, what have you seen and what are you doing today kind of in this new norm that may be different than what you did initially with the initial outbreak, but what are you and your staffs doing now in kind of this new norm?
Absolutely, yeah. Some of the things that have carried over since. So when it was very controlled and very limited access, we opted to keep some of those things in place. So temperature checks at the entry points, the vaccines and the negative tests prior to admissions assures that spread. I think I mentioned that the clean home protocols is what we implemented within our systems here to assure post uses of the restrooms and common areas and things like that. The team was documenting and following up on cleaning those areas and disinfecting those areas to assure we're meeting those standards of care.
Awesome, thank you. I love that you mentioned like safe and engaged. I think that really kind of will speak, and we will probably hear from the others in the panel about how they found creative ways to keep their residents engaged while maintaining that safety. Vicki, I would love to hear from you and Synergy on how you guys have kind of navigated the pandemic.
Yeah, thanks. So I think our biggest challenges, similar to everybody in this industry, have been around staffing. And then specifically around matching up, we've got a lot of families that are looking for only vaccinated caregivers. And then you maybe have some folks that are hesitant on getting vaccinated. So we've been trying to educate caregivers on the importance of vaccination, on keeping themselves safe, their own families safe. And the other thing that we've done to kind of navigate through some of these staffing issues is we've had a lot of folks here displaced by other industries. So whether it be the hotel industry or the restaurant industry, as those markets kind of closed down temporarily. So we tried to take a unique approach to recruiting and finding some folks. Our approach was, if you've got a good heart and you want to take care of folks, we can teach you and train you how to be a caregiver, some of those skills that you need, but you just need to have a good heart. So that's one of the unique approaches we did, was just trying to mine some of those markets that maybe weren't where traditional caregivers came from.
I think that is such a neat idea, and really being able to kind of leverage what was potentially a negative of the pandemic, that people were displaced from other careers, and being able to like utilize that as somewhat of a benefit. Can you share how you were able to potentially recruit people from outside of like the healthcare sector over to Synergy?
Yeah, so really it's, we're using some different recruiting websites, some of the similar, websites that everybody knows for job searches. And rather than just simply, typically what a recruiter would do is enter in care provider or, healthcare aide. We'll enter in some different descriptives, enter in some things around the restaurant industry or around the hotel industry. Several folks in this market specifically have come into healthcare out of that hotel industry. We've seen several of my counterparts at different companies they have a background in hotel. So it's really just, being creative on when you're doing those searches to look for people.
Wonderful, thank you. Kelly, can you provide some insight into some of the biggest challenges that you have faced?
Well, our biggest challenge that we face is knowledge. It's very, very difficult in our community because of who we serve, and our participants have varying degrees of psychiatric illnesses and behaviors that are associated with this. So we've always stayed true to our roots, and it's about family. Our staff has been absolutely amazing throughout this. We did not have a lot of turnover with our DSPs or direct support professionals. In fact, they all stepped up. They all realized that our participants were their family, and that we were here for them, and that we are here to acknowledge their fear. And I think that's where it came down to. It's acknowledging the fear that we all had related to the COVID-19 pandemic. And it's about educating appropriately, teaching our clients about proper hand washing, teaching our clients about the 6 feet rule, teaching our clients that I'm so sorry that you're not able to go out in the community today, but let's do something virtual. And it was about seeing us still. Our direct support professionals, as well as our management team, is very visual in our homes with our participants. So it was keeping that connection with our clients. And it was about transparency. Up to the minute changes. As things changed, it was transparent across the board. You knew when we knew. So it was about COVID testing. It was about explaining that, yes, you're going to come in and you're going to get COVID tested twice a week, and we're going to give you a high five, and we're going to say thank you very, very much. And we're still going to operate the way we normally do. Just things were a little bit different. We had to become creative about our virtual cooking classes, our virtual yoga classes, everything that our clients would be able to do in the community, we had to bring to their home. And then also deal with some of the behaviors that came along with the fear of the pandemic. And what we're still facing today is not so much staffing, it's about returning back to normal. It's about how our clients got used to staying in the home and don't want to go out into the community anymore. And it's about, the mandate is coming down about vaccinations, and it's about educating our staff about the risk versus the benefits, and understanding that 100% of our residential staff are vaccinated, and I have 96% of my staff that are vaccinated. So what we're changing today is just trying to get back to normal.
I appreciate that. Just a quick follow-up for you, Kelly. What would you say of the challenges or issues that have impacted you and your communities? Which one had the biggest impact on resident satisfaction?
I would have to say not being able to see their families. Not having that normal interaction with families, not having that normal interaction with their doctors, not having their normal interactions with the pharmacist. Genoa is a big part of community living family. I'm not going to lie, our pharmacist knows each and every one of our residents by names. And when they walk into the pharmacy, it was having that normal. I think for our clients to understand what was going on was very, very difficult. And that's one of the things that we really focused on, is trying to keep it as normal as possible, but understand that there was some fear and that we needed to keep all the safety protocols in place in order to keep our clients safe.
Wonderful. I appreciate that. Can you share a little bit more about what your local pharmacy staff did to try to help ease those burdens and make sure that your residents were taken care of?
They were amazing. Dan, Danielle, Jessica, Amanda, Fred, our little Genoa team down in Rhode Island was amazing. They would send care packages to the houses. They would send care packages to me. They would make sure that there was no interruption in services. It was, ever changing in the COVID pandemic. Somebody's not feeling well. We have a new prescription that would come in. It was about the ease and the communication that happened. It was about being able to pick up the phone, and the first thing out of either one of ours mouth was, "How are you doing today?" It was not about what you need, how you need it, and how fast you needed it. It's about, how are you? And thank you. And what can we do? It was very, very difficult for my staff not to be able to see our pharmacist staff because they're just a part of our family. And I know it sounds cliche, but again, our normal was to be able to call the pharmacy, get what we needed right then and there, and knowing that everybody was staying safe and knowing that there was no break in services.
Wonderful. Thank you. So we'll move on to our next question for our panelists, which is, what pain points does your clinic staff experience, and how have you addressed them to maintain your high service levels? Vicki, if you wouldn't mind to kick us off with this one.
Yep. So I think for our clinical staff, it's our caregivers. And the reality is there is fear about COVID. So one of the things we do is we provide all PPE for all of our staff when they're going into anybody's home. We provide that. We help them arrange vaccinations if they want to get the vaccine. We're bonusing for that vaccine. So trying to make sure that they keep, that they stay safe. The other thing we're doing that we've just initiated is actually having one of our management team reach out to every one of our caregivers every other week, just a touch point of, how are you doing? How's your family doing? Is everything going okay? Typically in this industry, when we're calling those caregivers, it's always, can you pick up a shift, or can you work at this person's house? Well, we're trying to, step back from that and say, let's just do a touch point, and how are you doing? How are you managing through these situations? How's your family doing? So trying to really, boost up their morale from that perspective.
I appreciate that. I think, Vicki, you just touched on a point that Kelly Anne kind of hit on. It's really empathy, right? And that care and genuine concern for each other as employees or employers, as well as those residents we serve, and how much a little bit of empathy and care for each other as a human being really has an impact since, kind of post-COVID. I think that might be a silver lining that we take out of this whole pandemic, unfortunately. Anthony, I would love to hear your thoughts on this as well.
Absolutely, thank you. Yeah, empathy goes a long way as one of those core values with the Majestic Residences. Being empathetic to your team, their struggles and strife, they are a key component to what we do. And as we know, we're only as good as our weak links, so we don't want to have any of those weak links. But if we can jump in and support that team member wherever they may be at, it kind of helps curb some of those weak links. Training, making sure that they have lots of support from sick time or paid time off if they need it. Having a core group of folks that were willing to step into that COVID team role in an emergency, and we were at a loss of multiple teammates, what would we do at that point? Did we have a team in place to step up, take on that role, or almost move into the home for that duration? And just kind of having those protocols and plans in place to assure when and if we were in that crisis moment, we had the people in place to fill those needs. But retention's a huge component of that. So benefits packages, bonuses packages, some of the things that other communities and homes have implemented just to assure that that team and that core is in place together in a unified fashion, and not scattered and fragmented. We don't want a team of folks that are all just kind of doing their own things, but creating that unity, that oneness, that togetherness within that home structure assures quality care for not only your residents and your families, but your team responds well to it, and usually you're able to maintain those relationships. And relationships go a long way in what we do, whether it's with our residents, our families, our team. So making sure that we're investing that time and effort into maintaining those healthy relationships usually pay well and minimize those pain points for all of us.
Absolutely. Definitely a relationship business in more than one way. Kelly Anne, would love to hear your thoughts on some of your biggest pain points and how you have addressed them.
I think mostly it was about COVID hit and things changed. The way we did things definitely changed, and the planning revolving around it. We do have a CRT team, which is the COVID response team, that was constantly planning, constantly seeing, constantly trying to be one step ahead. We had a very difficult time right at the beginning getting personal protective equipment, and went to the hospitals and went to other things other than group homes. So we had a whole bunch of our staff, as well as staff family members, come in and make masks with us. We didn't have the surgical masks, so we had literally about 4 or 5 sewing machines out ready to go, and whoever could help came and helped. My mother, my mother-in-law, they all came out to make masks, along with our CEO's mom and a lot of our direct support professionals, as we could kind of place people around, really came to help us. And when it came down to it, is that personal attention that everybody would get, which we come back to our roots again. We always wanted to create that home environment, that family environment, which we have with our DSP staff. I know pretty much, I have 164 staff. I know each and every one of their names and how many children they have. Are they married? What's going on? So when I talk to a DSP staff, my first question is not, can you pick up a shift for me? My first question is, how are you? How's your children? What can I do to help you today? That fear. Yes, did I have some of my staff contract COVID-19? 100%. Yes, and some of my residential staff did, but it was when you step up. Some of my clients did get COVID, and then some of my DSP staff did live in with a couple of my houses for a month at a time. They left their families because they knew that our clients and our residents needed them. And then that was the big thank you that came along with bonuses, that came along with raises, that came along with care packages being brought out to the house. Every time somebody would contract COVID, they would get a personal phone call from me, personal phone call from our CEO. How's things going? What can we bring you? Is everybody getting tested? How can we help with that? Would you like to be vaccinated? When would you like to be vaccinated? When do you need your COVID test next? And sometimes it was me going to their homes and COVID testing them right outside their door and quickly running it to the lab because they wanted to get back to work as quick as possible. How did we maintain the high level of service? We just continue to do what we normally do, and that's take care of our residents with a smile and with an open heart.
I appreciate that. And thanks for every one of you sharing. I think the main, theme there is all about, I think we talked about the empathy, but like community, right? Your staff and those residents and those that you take care of all become part of like the larger community and that family for, I think many of you touched on that. And all the things that we are willing to do to help out those that we love really kind of speaks to what each of your teams have done during this difficult time, and really appreciate the service that they are providing for sure. So we'll move on to the next question. What pain points do your residents and their family members experience, and how have you helped address them? Anthony, I will start with you.
Thank you. Pain points, a lot of those ones revolved around, again, connection to the families and the residents, as they're used to a very open door, very comfortable, lots of family community involvement. So the pain point that they felt, I think most of it was that fragmented connection. So implementing lots of different technologies, which everybody knows that FaceTimes, Zooms, I mean, all those different things to create those connections. Having certain spaces or areas with barriers around residents, mask requirements, things like that to, again, address those pain points so that way those families are connected. Cost was another one, as they had to endure the financial hardships, whether it be not having the same incomes that they had previously, or the cost of care had increased as we're trying to maintain those teammates, maintain the home's standards the way they're expected to be. But sadly, that had come at a cost, and I think the families felt some of that costs. Trust was another big component, as there was so much uncertainty as to the next day, the next week, the next month. So having those families, building a strong relationship with those communities, those homes, the operators, they had trust and confidence in the ability to meet the residents' needs, keep the care as a priority, and keep that connection of the family together. So those were quite a few pain points that we had to address and continue to try to address and keep forward.
Would you mind to share briefly with us some of the technology or things that you guys utilize at Majestic Residence that really kind of provided maybe a better experience for the residents, despite being able to see some of their family members or caregivers as often as they would have?
Absolutely, yeah. Monitoring systems as they would enter the home, PPE as everybody would utilize that. We had technologies like the web platforms for interfacing with the doctors, the physicians and clinicians, was a nice addition to what we already had. And that was a big change, is we didn't see a lot of that telehealth that we now as a kind of a core component. So that was a technology addition. Lots of tracking in that admission points where there was a point of contacts. We're utilizing a hands-free visitation where the families would scan a QR code, and that would log them in with all of the pertinent questions. So signing kind of the old-fashioned documentation of taking your temperature, sign the book. It created a contact point where there could be spread. So if we took that hands-free out of the equation and made it very streamlined with technology, still met all the criteria and the needs, but took a point of contact away for those potential spreads. The Zoom, I think Skype is still one that's out there. FaceTime is what we used. There were these neat tablets called Grand Pads that were simple iPads with limited technology features in there, but gave one-on-one connection where that resident didn't have to scroll through a phone book, but simply touches a picture. And if they couldn't get to that particular person, it would go to the next person in its registered line and kind of keep calling until they got connected with somebody. So those kind of implementations of technology assured to keep those connections intact and those residents' spirits, as high as they could be, all things considered.
Thanks, Anthony. Vicki, would love to hear your thoughts on how what your residents experience. What were their biggest pain points?
So, I think I'm in a little bit different position than Anthony and Kelly Anne, in that we are serving a lot of folks in their private residence, in their own individual home. And what we saw is during the pandemic, a lot of folks staying in the home longer than maybe they normally would have stayed in the home, because there was some fear about moving into communities. So as a result of that, we were dealing with folks that needed a lot more help than traditionally would have, you would see in a normal home setting. So what we ended up having to do is collaborate with those family members, with their loved ones, and then with our caregivers to build really more rigorous care plans, really making sure that they are, getting all the help and all the ancillary services that they might need. So oftentimes it takes a village. So oftentimes we were helping them bring in, maybe we could get some OT and some PT or some skilled nursing brought into the home to try to help them stay there as long as possible, but still make sure all their needs are being met. I think that's the biggest thing. We're starting to see that. We were starting to see it change as the numbers went down, and then numbers creep back up again. So we're kind of seeing that second wave of people building a little bit of hesitancy of moving, but I'm hopeful that that'll be short-lived. But really for us, it's providing that service of what else do you need besides our services, and how can we help you get connected with those providers, those ancillary providers.
Yeah, I'm sure that is a challenge, obviously, as people stay home longer, which we would love, but it does cause a different set of challenges when they're unable to kind of age into other services.
Right.
Kelly Anne, would love to hear your thoughts from your community.
I think most of our challenges when it came to residents and family members was not being able to see your loved one. And you or myself and my team having to be the one that says, I'm sorry, but you can't come to the house today. Like Anthony said, we have an open door policy. Family members can drop by the house at whatever time they choose to spend time with their family members, to spend time with the participant. I think it was not having that personal touch. That became very frustrating for a lot of our residents, which led to a little bit more of a behavioral challenge. And for our family members, it was about the transparency. This is what's happening with your child. This is what's happening with your family member. We're here. It was a phone call from our CEO right down to our DSP staff to be like, hey, how's things going? Let me put you on the phone with John, or let me put you on the phone with Sally. Let's have that connection. During the nice weather, it was about building a barrier or building a nice space outside so parents could sit halfway across the yard and our family member can sit on the other side, and we had virtual high fives. It was about becoming creative. I think, again, having that patience and asking your family members and asking our clients to be very patient with us, because things are constantly changing. And our number one priority was to keep them safe and to keep them away from COVID as much as possible. So we got creative. We actually put out a survey to our family members. They could join our virtual land, which we did virtual yoga classes. We did virtual cooking classes. We had dance-offs. We had, around Christmas time, we had our own Christmas virtual party. We became creative in every way possible. Each of our homes had an iPad in the house, so they were able to FaceTime, Zoom, virtual meet with any one of their family members. They actually could FaceTime and Zoom with us on our off time. I had a client that would call me almost every night around 7:30, and him and I would FaceTime for about 10-15 minutes, depending on what was going on in my home. And that was his connection. That was what he wanted, and that's what he needed at that point in time. Not only me, but they would call our HR director. They would call our CEO. Our participants have full reign over who they can contact and who they can call, as well as our parents. So it was about that transparency. It was about having that patience. And it was about our DSP staff really stepping up. Community living is very competitive. So we would actually send out things to the houses so they would one-up each other. So who could make the best Valentine's Day card? Who was going to get the pot of gold at the end of the rainbow during March, during St. Patrick's Day? And it was about putting them up on WhatsApp and saying, you know what, they're having fun. Yes, we have a pandemic out there, but our world still goes on. And how much fun can we have while in a pandemic? And I think they had a lot of fun. Now that we're starting to come out again, they're still wanting to do the yoga classes, the cooking classes. We still have a dance off every Friday night at 7 o'clock. So it's actually kind of fun. That's how we've addressed it. And our family members can come into those dance off and those parties as much as and how often as they would like, or as little as they would like.
That's cool. I think one of the main things with everyone's kind of response to this question was really around collaboration, having to kind of think outside of the box and utilize some other resources that might be available to us that previous to this we wouldn't have even maybe considered or thought about. So being creative and being able to utilize those tools that we had at our kind of disposal really had some big impacts. And potentially using them in ways that we didn't do before. Who would have ever thought we would have had dance-offs via Zoom, right? So kind of a cool opportunity and a neat way to utilize the platform and what you had available. So we'll move on to the next question now. We really want to talk about how integrating pharmacy services has helped address some of these pain points and challenges. So whether that is census or is that staffing challenges, would like to hear your inputs and thoughts on how a pharmacy partner can really impact that. Vicki, would like to start with you.
So again, we're in a little bit unique situation because a lot of our residents aren't in a traditional senior living community, but we have actually found opportunities where we can use integrated pharmacy with our individual residents. We've got several who are suffering from Parkinson's, and we've got a lot with dementia and Alzheimer's. And there's some paranoia around medications, and as caregivers, we're trying to do med reminders. There'd be challenges. There's one specific client I can think of where she questioned one particular new med every single day. I'm not going to take it. I'm not going to take it. I don't think I need it. You know, we were having to call family members to try to coerce her to take this medication over the phone. We brought in Genoa, and they were able to do the pill packs for her and really alleviated. There's no more phone calls at that time of day of, okay, you know, this patient's not taking this medication. She trusts because it's in a sealed, compartmentalized package. She believes that it's what her doctor has prescribed, and she is taking them. So again, it's, you know, I look at it as bringing in those services. We heard a need from our caregivers, from this resident's family of, you know, this particular person doesn't want to take their meds. They're questioning everything. How do we partner them up with somebody that can help them? It wasn't going to be our caregivers. We can't, you know, force anybody to take medication. It was going to be, you know, getting the right people involved that can figure out the right solution from a packaging perspective to where there's trust around those medications. So that's where we've seen it help us.
Wonderful. Thank you, Vicki. Anthony, would like to hear your thoughts on this.
Absolutely. Working with a great pharmacy partner makes all the difference. As our residents are usually heavy into medications or sliding scale insulins, assuring those medications are right resident, right dose, right times, right route, all of those kind of core essential things are implemented with the pharmacy partner, the auto delivery service of those medications, and kind of the collaboration between the resident, the physician, the pharmacy, the family, the team in the home. All of those components come together to assure those residents are getting what they need. Having, again, that great pharmacy partner when we needed to roll out the vaccines, as we were offering it to all of our residents, families, you know, team members, having that good partnership with a great pharmacy allowed us to host at the homes the actual vaccine distribution. So lots of good recording and record keeping for all of those things. Again, without the support of a good quality pharmacy system like Genoa, we wouldn't have all of those benefits that our residents were able to kind of tap into when they needed.
What would you say is like the most common medication issue like that would affect customer satisfaction? What do you see from a medication perspective might have an impact on resident satisfaction in your communities?
Identifying the medication, as there's, you know, two different, there's a retail medication and then there's the lesser known one. The pharmacy has been great about offering alternatives. Did you want this medication or did you want that medication? And that boiled down to our family's cost. It goes back to one of their pain points was the medication is the same medication, but this one costs 2 or 3 times it because it's a name brand as the other one doesn't. So having that pharmacy partner that can even bring it to our attention or the physician's attention to say, hey, you've got 2 different medications for insulin. One is really, really pricey, one isn't. Do you want it? And then the physician can rewrite that order in accordance with what might be a little bit more manageable for the families. And so again, having that really great pharmacy partner really made that big difference in a lot of those areas.
I appreciate you sharing that. Kelly Anne, I would like to hear kind of your thoughts on how pharmacy has helped impact your communities.
Genoa has provided us with no interruption in services. They've provided us with the fluidity that we needed. Community living of Rhode Island, we only work with certain providers, so it allows that communication to happen. Genoa has been wonderful with the providers that we have chosen to form relationships with them. So we only use one primary care physician, we only use 2 psychiatrists, we only have 1 podiatrist, we only have 1 cardiologist. Therefore, our participants get used to certain providers, and this way here it can give our Genoa people, my Genoa family, their chance to interact with the pharmacy as well as the providers. And it comes down to there was no interruption, great communication. In the times where things were a little bit dicey, what is needed, when is it needed, and how quickly can I get it? Some of these medications, as Anthony brought up, can be extremely expensive. My participants are on a fixed income. So when it came down to it, it's what medication do we truly need? How much is it going to cost, and how much of an impact is it going to be? We have one, I call her the magical unicorn, Danielle at Genoa, who I don't know how she does it, but she just magically makes no co-payments, which is huge because I know she's constantly on the phone with my doctors, constantly seeing how we can switch something, and then on the phone with me saying, okay, we can get Latuda at this price, but then we can get Losartadone at this price. What would you like to do? It's about the communication, and it's about the monthly delivery, and it's about our clients knowing that they get the same exact meds every month. It's in the same exact packaging. They know on the beginning of the month or in the middle of the month, their meds are going to show up at their house magically. It's, again, about the communication. It's about also helping us with vaccines. We actually sent up vaccine days, which I was really excited about. We had tents out in the back of our parking lot and tried to get as many people as we could vaccinated along with our residents. And I was so lucky that, again, our pharmacy staff knows our residents. So there wasn't that fear of coming to get a shot from somebody they didn't know. That was very huge for us, because I know my participants don't like new people. They don't like unfamiliar faces. They don't trust them. And then knowing that our whole entire community living team was there, and also our Genoa team was there, was big, because it was that virtual high five, that ear high five, and then let me give you your shot in your arm. And again, it was a family, and communication was, again, key.
What would you say is the biggest medication related issue that you potentially affects customer satisfaction in your communities?
Polypharmacy. I think it is about adding another pill to a cup when somebody's having a bad day. We require, I meet with the pharmacist, the psychiatrist, as well as our behavioral specialist once a month. That's one thing that Dan, the pharmacist at Genoa, does with us, and Fred, is to come to us and saying, okay, let's look at all these medications that our clients are on. Where can we cut back? Where is our behavioral challenges going to be? I'm more about, let's try to tweak the behavior, then add another pill into the cup. And where Dan, the pharmacist, comes into play is he'll say, oh, okay, we can go with this medication, and let's see if we can taper this one. And then it's about the team approach that we have. And polypharmacy is big. About 75%.
I love to hear about that. Sorry, go ahead. Finish.
And it's also a big thing to be able to cut somebody's meds down and to have all the team on the same page.
Yeah, I love to hear that collaboration, because as a pharmacist, that is what we went to school to do, is to help be collaborative and to really provide some input on patients' medication profiles and how we can address and obviously minimize the number of medications that people are on. I think, to your point, it's very easy to continue to add medications, and you'll see someone that goes from a handful and then all of a sudden they're on 10 or 12. And being able to really look at that complete medication profile and make some recommendations and try to minimize the amount of medications that any of your members or residents are on is such an opportunity for us as a pharmacy team to have an impact. So I appreciate you sharing that. So we'll move on to the next question. What is your community doing to stay competitive in the face of the changing landscape and potentially the shift to at-home care? Kelly, I will start with you.
We've had to become creative with our recruitment process. We've really tried to scale it. Again, community living is about word of mouth. Every time a person comes in, they said, oh, I heard from this person to come here and apply for a job. They really like what you do here. They say thank you. I think where it comes down is to stay competitive with the wages, making sure that our clients get the best care possible from the best people possible. One person always says to me, or I say to people, that a person is going to work with you within the first 7 minutes. Are they going to be a good fit for you and for your company in the first 7 minutes? And usually usually after the first month, if you don't want to be there, you leave. being a DSP staff is not for everyone. It has its challenges. It's not every day is different. You're not walking in and doing something monotonous. You're actually going in there, and something could be as little as a behavior that could change your mind of whether you want to stay or whether you want to go. So what we try to do is provide as much education and support as we possibly can to our DSP staff. And I think that's where we're different. We have a response team, a rapid response team that will go into the home if our DSP is having some problems with one of our clients, to be able to support them, whether it be on the phone or actually on the ground at the residence. We stay competitive by just saying thank you. Our DSP staff stay because they're happy, in which we want to continue to make them happy.
Absolutely. Anthony, would like to hear your thoughts on this.
Absolutely. Creativity and innovation seems to be a common thread here. Technology as well was a big component for us, as we have the Majestic data management system, the Majestic menu systems, a really neat incontinence program that has an RFID tag that would be on the exterior of a brief, and we're able to get metrics on exactly how quickly we're able to address those needs as a resident may have an incontinence issue. So implementing some of those technology was able to produce numbers and informations to families, residents, and clinicians of everybody's got great care, but here's the numbers that show our great care. And so having those numbers and being able to provide that information really assured resident occupancy was high and resident retention was also high. Back to the team, recruiting and training and maintaining those great relationships with your team was a key component to what we did previously, what we will continue to do, because stability goes a long way. You want to have those familiar faces, those familiar routines, and that familiar knowledge in place for the duration. It goes back to kind of our core values of those honest, observant, those home values. Be honest and observant, create memories, and be empathetic. Feel your families, feel your residents, meet them where they're at, create those connections with those families. Be observant. If you see something, say something. If there's something that needs to be addressed, make sure everybody feels very comfortable, whether it's a family, a clinician, or a team member, that they can say something to that management team and something is addressed with it. And then being transparent and honest with your teams, the families, creates that trust, that community, that they can be confident in you, your knowledge, your ability to meet their needs. And what I always like to say, we have an attitude of gratitude. We're grateful for those team members that want to be a part of us. We're grateful for those families that trust us. We're grateful for those residents that want to be a part of our families as well. And it just creates a different culture in those residential home settings that we find very successful and look forward to duplicating for many years to come.
Thank you, Anthony. And Vicki, would like to hear your thoughts on this as well.
So for us, maintaining our competitive nature and being competitive in this marketplace is really about relationship building with our current existing families, with our caregivers, with our prospective families, and with those ancillary services that can help our families. So what I like to say is, if you call Synergy and we can't help you for whatever reason, whether it's a financial issue or we're not the right place to help you, we will get you in touch with those services that you need, whether that be skilled nursing, legal, elder law advice, placement, services, any of those things. We're going to help you get connected, bringing in hospice, all those different things that might be what somebody needs when they call our company. We like to be known here in our marketplace of, we're going to be your trusted advisor. We're going to get you the help you need, whether it's our company or whether it's other ancillary services. So that's really how I think we've maintained our competitiveness here in this marketplace.
Yeah, it really sounds like you're driven to find a solution, right? So be solution, whether it's you or someone else, it's about kind of finding a solution for each individual family, which I think is exciting. Just a follow-up question to the group. How do you see medication-related issues affecting your potential future sustainability? So are there things that come up from a medication perspective or a pharmacy perspective that could potentially increase or decrease your like overall profitability or sustainability? Just would like to hear your thoughts on that, and whoever would like to jump in.
All right, I'll jump right in there. We'll take it on. The pharmacy partner that we worked with here, Genoa, has been great to keep those costs down for the families and make very fluid services. So there isn't really a whole lot of drop off in medications and communications. There's a lot of good support in each step of that, whether it be from start of ordering the medications to the actual administering of medications. I don't see anything that could hinder it as we've utilized the EMR system and the technology. That implementation has kind of taken things from the old longhand paper format to a much newer streamlined format. And I think those are positive things as we see everything kind of going cloud-based, technology being cloud-based. The operators, the management team has the ability to access that information in real time wherever they're at. So they don't actually have to be on site to answer a question or to address an issue. So that's been a nice change too. I've only experienced positive changes with implementing a good pharmacy system and a good pharmacy partner. I haven't had a whole lot of negative experiences, but if that does happen, I have trust and confidence in those relationships and with those teams that we've put together that they can address those in real time and fix whatever issue it is so it doesn't reoccur if it should arise.
Anthony, can you talk really briefly about the EMR and that interoperability between the two and how that has impacted your efficiency in the home?
Absolutely, yeah. Time is a huge component of what we do, and passing the medications, very time and labor intensive. The amount of time a caregiver would have to be focused in that med cart, addressing the issue or filling an order of medication. All of those things were streamlined with the EMR system as it's auto-populated for us from the physician and the pharmacy. They are inputting that information for us, which on our end makes it very easy to look at a particular resident, see what those medications at the right time may be. If there's any interactions or questions, they're able to get that information in real time. So lots of great things have been implemented with the EMRs, and I go back to time. I think what took hours of time, now we're able to do in minutes of time. And for a caregiver who's on the floor with 5 call buttons going and 2 family members there and a hospice in-house, for them to be able to take what used to take hours and do it in minutes was a game changer within the residential assisted living settings.
Thank you for sharing that. Kelly Anne or Vicki, do you have any thoughts on how medication issues could potentially impact your businesses?
I can jump in. I would say just as we get more and more folks that are on the automated or the more automated, the pill packs, the delivered system, I think in reality, you will be able to see some folks maybe be able to stay home a little bit longer because families will trust that, okay, they're getting these 3 different pill packs and we know that they know how to take them. And so I think it will allow some folks to be independent for a little bit longer.
I think where we're seeing in the residential group home setting is we are moving towards the EMR system, which I can't wait. It's going to be greatly exciting. I think it's going to be different. It's going to be a learning curve. When it comes to our integrated pharmacy team, when it comes to Genoa, they've kept our co-payments down. They're able to look for alternatives, so we're not getting astronomical. All of our participants are on Medicaid, Medicare base, so there can be some co-payments, and it's looking for alternatives. And again, that good communication. Like Anthony, I've only had positive interactions with Genoa. I've never had any negative, and even if it was negative, it was fixed in a moment. That open communication that, hey, this is what's going on right now, what can we do to fix it, was always the team approach that we've had. And again, I have great confidence in Genoa. I've been with them for over 7 years. I wouldn't change.
Well, I appreciate that. Thank you very much for your kind of candid feedback. So next, we kind of just want to throw this out to our audience, and our panelists will touch a little bit about this. So if you can just submit your answers in the question box, but we want to just hear from those that are joining us that despite all of the challenges that each and every one of you face, what is it about the community that you serve that excites you to get up and go do the work every day to provide quality care. So would love for our attendees to put that information in the question box, and then I will just have our panelists briefly kind of share what gets them excited, what their why is for getting up and going to work every day. Vicki, we'll start with you.
I love seniors. I've never met a senior I don't love. I love helping them. I love when they say, oh my gosh, I had no idea how to do this. Thank you so much. That's what gets me up. I think about how I was when my father was first diagnosed and not really knowing how to navigate everything. And I never want another family member to feel like that. So whatever I can do to help somebody get to where they need to be, that's what I'll do.
Anthony, what about you?
Absolutely. I'll mirror that statement. People, we love what we do because there's no other career that has the same emotional fulfillment. Doing accounting years and years ago, you punch the clock, you go home, and that's it. The numbers work out. Here, if you do a good job, it's reflected in your family's positivity, the residents, the smiles, the laughter, and the engagement of the home. It's a culture and a vibe you can feel when you step into any Majestic Residences, and that's what sets us just a little bit apart from every other residential assisted living that's out there. As we know, there's a lot of them. We love the people and love what we do, and look forward to doing it for many, many more years. Yeah.
And Kelly Anne, what about you?
It comes down, they're my family. I always say that I have 75 children, not just one. I love going to work every day. Every day is new, it's challenging, it's fun, it's exciting. It can be a little scary sometimes, I'm not gonna lie. But mental health is a ever-changing environment. When I can see one of my clients having a challenge that day and I'm able to go in and being able to help them, and then getting a hug in return and saying, they don't call me Kelly Anne, they call me Nurse Kelly, and getting that connection when I'm able to call a family member at home and saying, you know what, everything is okay. We're going to go through this together. I think it's the atmosphere that I work in. My CEO, CFO does have that family atmosphere where they know everything that's happening. And so our clients really feel that family and that love, and that they know that this is their home. Yes, they may not be able to go home to their moms or their dads or their family members, but they're home with us.
Well, I appreciate that. And we've heard the word home quite a bit today. So I think that home and that sense of family is really what kind of has helped us overcome a lot of these challenges over the last year and a half. I want to take this opportunity to thank our panelists today. So Vicki, Anthony, and Kelly Anne, thank you for joining us and sharing your insights from each of your communities. And I will let Brittany take it from here.
Thanks, Stacey, and thank you to all of our presenters today. It was fabulous hearing all of your experiences and expertise. And we also wanted to thank all of our attendees for joining us today for improving resident satisfaction and outcomes by integrating pharmacy services in home care, group home, and assisted living settings, brought to you by Genoa Healthcare and Open Minds. And just a reminder to everybody, we will be sending out an email later on that will have a link to download the PDF of today's presentation, as well as listen to a recording of today's session. And any questions that you may have asked, we will be responding to on a one-on-one basis after today's broadcast. Have a wonderful day, everyone, and thank you.
Thanks, Brittany.